Hello, everybody. We carry on with our podcast. That is a topic that everybody wants. It is talk about T.M.Js. T.M.Js is the most famous joint in our body. Every person knows what is the T.M.Js, and sometimes they confuse because they said that I suffer T.M.Js. No, you don't suffer T.M.Js. You suffer the T.M.D, temporal mandibular disorders. In this series of podcasts, I will try to talk about this particular joint for everybody, for patients and for dentists, because in my experience, this is my personal experience. Experience is personal, and I believe that is not well known the T.M.Js for professionals and also for patients. I'm in different groups of patients who suffer T.M.Js, who suffer chronic pain. Obviously, when I am saying chronic pain, I suffer because chronic pain is a very, very bad word, because if we said chronic pain, we are saying we don't treat very well the patients. That's why they have chronic pain. Something is chronic, it's because the treatment was bad, was a not good patient. It's a lot of suffering, a lot of patients who suffering a lot. I am very upset for them. That's why I want to do this podcast, to talk together. And if you subscribe in our channel, you can make questions. You can be part of our community. You can tell me which topics you want to develop in our channel. Don't forget, subscribe to the channel, do a like to the podcast if you like it, and if you click the bell, you will be updated with all our transmission. Okay, we're back to our famous joint, our famous temporal mandibular joint. These problems can be prevented in early age, and I suffer a lot. I'm a specialist in craniofacial orthopedist, and I see a lot of young people who the dentists say, don't wait when the teeth change, we will put braces and different things, and that is a very, very big error. In that age, we can develop different treatments to prevent disease in the future. Remember, for fathers and mothers, this is a message for all of you: not wait. Braces is not a therapy. Braces is a biomechanic to put the teeth straight, nothing more. But orthopedics, craniofacial orthopedics, is the real specialization. Why? Because you guide the growth. You do a re-education of the muscles. And if you work in alimentation, intoxication, structure, mind altogether, you can prevent a lot of diseases in the future. Don't forget, don't miss the growth. But we are talking now about T.M.Js, and I like podcasts because the podcast is very nice, because we can listen. You can put your earphones and you stay listening to me if you are cooking, if you are driving, if you are doing different things. That's nice. Podcast. I love podcasts, and also I love videos. In our channel we have a lot of videos, but this talking is nice because it's just listening. And I feel like if I am talking with friends, a lot of friends all around the world will listen to my talks. T.M.J is a very special joint, and I want to explain something quick. this joint is a particular joint, just for this is for patients, and also to refresh the knowledge for professionals. Difficult to have two condyles in a joint, but T.M.Js have two, right and left, in the lower jaw. That's why we call that joint a bicondylar joint, but also synchronize it, because we cannot move one condyle and the other. No. Synchronization. Another functional thing we have to understand. This particular joint do not accept for any reason increased depression inside the temporomandibular joint. That is important tip, because when increase depression. So that's a very good question. When depression is increased into the temporomandibular joint? Obviously, when the teeth do not stop a right position in the jaw. We call in our face, it is divided in three parts. The upper part in the front, the middle part where the eyes are, and the lower part where is the mouth. That's the lower third. When that is less than the normal, is increasing the pressure into the temporomandibular joint. And if we have also a retroposition, that means the jaw back than the normal, more dangerous, because we increase the pressure, but also we are making the invasion in the retroarticular area. This area is the life of the T.M.Js, the back of the joint. That's why there enter the blood, the nerves, the whole life for this particular temporomandibular joint. If we invade it, we risk to create a necrosis. That means death of the temporomandibular joint. That's why our guardian, who is the central nervous system, the main computer in our body, have programs for defend. In that area, we have the most important receptors of the joint, of the temporomandibular joint. Receptor type 4. There is the quick reaction, and they have reaction to the pain, and they never adapt. Why? Because we have to defend this area. Something is wrong there. Wow! Alarm to the guardian, to the central nervous system, and the central nervous system immediately reaction. Do you know what is the reaction? It is a very bad reaction, but it's the only one the guardian had. But it is bruxisms. Bruxisms is a defense for something wrong into the temporomandibular joint. And what is the defense? If we have the teeth who lock that position, the software said destroy the teeth. How? Bruxisms. But that is worth, because we destroy the stop and we increase the pressure, and we have neuromuscular activity increased in the cranial muscles, and that is creating a lot of problem in our posture. Imagine we have a defense, automatical defense, but it's very, very, very bad defense. But it's the only defense we have. We destroy the teeth because the central nervous system think that the teeth is the cause, but it is not the cause. The cause is the wrong position of the jaw. The teeth are guilty to block that position. And that's why central nervous system try to destroy it, increasing more the pressure and creating a circle who never stop. That's why a lot of people suffer T.M.J's problems, temporomandibular disorder. Another question, another thing I have to tell you, in the temporomandibular joints, like the same in the whole body, we have two different sorts of problems: functional problems and dysmorphisms problem. What I mean? Functional is alteration of the function. Most of the problems are connected with this in the TMJs. And the other is dysmorphisms. Dysmorphisms is alteration of the form. Obviously, if dysfunction is chronic, will create in the future dysmorphisms. Imagine a circle will never stop if we don't do something. We will do a podcast how to treat it, and the opinion of our school. And now we started with the temporomandibular disorder. Most of them are related with the dysfunction of something who is out of the TMJs. You know, some problems out can create the problem in the TMJs. For example, if you have a foot support problem, it can create an alteration of the jaw during the growth. If you have a vision problem, you can create an alteration of the position of the jaw. And also, if the growth of the craniofacial system is not going well, it is the main cause of the wrong position of the jaw in the adult. That's why it's very important, please, dentists and fathers, treat patients early. How to treat? With an interdisciplinary protocol, as is NPR. NPR is myofunctional postural rehabilitation, is for all medical sciences. Holistic way, holistic point of view, holistic treatment, interdisciplinary treatment. And then that podcast is nice. Now we will do more podcast talking about symptomatology, about treatment, about different things. And also, if you subscribe to the channel, you will see a lot of video also about TMJs. We will talk about fibromyalgia in the future. We will talk about the chronic pain. We will talk in different topics, and if you like some topics, just write to us and say, listen, I want you talk something about this topic, and I will try to do it. But the podcast is a very nice way to do it. Okay, my friends. If you like this podcast, do a like, subscribe to the channel, and you will grow our channel. You will help a lot to help another people. See you in the next podcast, and don't forget, subscribe, like, and bell. See you in the next podcast, everybody. Bye bye.